just as we consider things about the patients, we have to consider things about the drug. So for example, if I know I'm dealing with a patient that has kidney problems, next I'm going to look at drug or agent-related variables. So morphine is metabolized extensively by the liver, but it has many metabolites that are pharmacologically active that are excreted by the kidney. So if I'm dealing with a patient with renal impairment, and then I look at my little pot full of opioids I can select from, morphine might not be the best choice for that patient because of the way the drug is eliminated from the body. Methadone and fentanyl, for example, are metabolized extensively but to inactive drug products, so they would be a safer choice in somebody with very high renal dysfunction. I look at I need a drug delivery system, let's say, that is user independent. I have a patient who can't swallow. Maybe a transdermal patch would be a good idea. Sometimes it boils down to the cost. Patients can't afford a branded product. Maybe they need a generic product like generic long-acting morphine or a generic transdermal fentanyl patch or methadone, which is extremely inexpensive. If I have a patient that is not adherent to therapy, I probably would not go down the road of using methadone because you have to have very specific attention to detail in dosing and monitoring that drug. So lots of things about the drugs that you have to consider. Certainly efficacy is one. This is true of any drug for any patient with any disease. You want the drug that works the best for your particular type of situation. So also adverse effects. If one drug has a proclivity toward causing one adverse effect that would really be problematic for a specific patient more than another opioid, that's something to take into consideration. Age, for example, transdermal fentanyl. You can use it down to children, but the transmucosal fentanyls are not approved in children under 18 years of age. So there are things about the drugs you have to consider and things about the patient.